Hello, I'm Roberta Winters of the Radnor League of Women Voters and current president of the Delaware County ILO League. Today, I am most fortunate to have with me Kate Kadavil, a recent Radnor High School intern with whom I have worked for 3 summers. She also served as president of the League of Women Voters Club at Radnor High School, where she was involved in multiple voter registration and outreach activities. Kate, would you take a moment and tell us about yourself?
Hi, I'm Kate Kadavil, a recent high school graduate, and as Roberta said, I've worked with the League for the past 3 summers. In 2023, I completed an internship focused on the women's suffrage movement. I researched very influential leaders such as Carrie Chapman Catt and Alice Paul. Through researching their differing leadership styles, I saw how Catt's strategic diplomacy and Paul's bold activism made me realize a deeper understanding of the importance of advocacy and coalition building. I also had the opportunity to visit Bryn Mawr College's library and view Carrie Chapman Catt's special collections, which included personal letters to the then president Woodrow Wilson. This made me have history be brought to life and realize that these leadership styles are still needed in the present day. In the summer of 2024, I researched maternal health in Delaware County, and I met with Representative Borowski in person and Representative Curry over Zoom. I learned about the ongoing legislative efforts to address the maternal health disparities in Delaware County, such as the omnibus legislation. And this experience gave me insight into how public health and policy align, and how this will further improve health outcomes if we all band together to research such disparities. This fall, I'm attending the University of South Florida, and I will pursue the major of nursing. This summer with the League, I'm shadowing a nurse at the local elementary school, and this will help me gain hands-on experience working with children and seeing the day-to-day clinical responsibilities. I'm also volunteering to educate community members about the danger of lead exposure to children and how we can prevent that.
Well, thank you, Kate. You're very busy. I'm also lucky to have with me Rosemarie Halt, who has been a friend for a long time. Actually, the first League study I ever was involved with dealt with the public health needs in Delaware County. She did the presentation, she presented it to all the members, and we developed a consensus which involved advocating for a public health department in Delaware County. For years, I attended Radnor meetings and other meetings advocating for that cause, and as always, Rosemarie came through. And I would like her to tell us now a bit about her efforts involving public health and particularly her role in advancing the cause of maternal and children's health.
Thanks. And thank you and the League for all their support over the years, because that was really critical in keeping it going. But really, my first degree is in pharmacy, and I worked as a pharmacist for a number of years, but I was always drawn to public health. And so I went back and got my graduate degree in Master of Public Health, and then really started looking about what did I want to do. And I had a relationship with Maternity Care Coalition in Philadelphia, and so I reached out to them, and I became their policy director and worked there for several years and advocated for moms and babies, which was really rewarding. And then I went... COVID hit, and I was working with the transition team for the new Delaware County Council, who had campaigned on the issue of the health department. And they called me up and asked me to be the COVID director for the county, because we didn't have a health department, and we had to work with other agencies, including Pennsylvania Department of Health and Chester County. And so I did that for all through the COVID pandemic, which was a whole story in itself. But it really helped us build the health department. And so all through the pandemic, we instituted policies and programming that would align with the new health department. So I always say we were building the airplane while flying it, and we did. And then after that, I became the chair of the Board of Health for Delaware County, and then I began doing health policy consulting with Children First, which is another nonprofit serving children and families in the southeast region of Pennsylvania, and really advocating for health and education of all children. So that work led me into doing a lot of work around lead poisoning in children, and so I'm also head of the Lead-Free Promise Project for Pennsylvania. So there's a lot going on, all public health related, and doing a lot of good things in the area with a lot of good people.
Well, now that we've learned a little bit about your background, I'd like Kate and Rosemarie to share with us about this Cradle crisis in Delaware County, which is what Kate entitled her project.
Yes. So Delco Black and brown women are 3 times more likely to die giving birth than white women, and there are several reasons for this, which we will cover. But based on your experience, does this mortality rate seem reasonable?
Well, yes. I mean, it's not reasonable that we shouldn't be that high. You know, the United States in general is much higher than all the industrialized countries in the world. And it's not just mortality, it's mortality and morbidity. Women come out of pregnancy sicker here than in other countries, but mortality rate is certainly much higher. And so what we're looking at is why. And it's been that way for a long time. And so why is it so intractable? Why are the reasons? That's what public health starts to ask, like why? What are the, other than just the statistics? And so the other frightening thing is, while that's the average, there's communities that have even higher rates, like the city of Chester is 4 times higher. So I think those are the things we really got to look at, the data that is showing us where, there's places that have greater incidence of mortality, and what are the social determinants of health or other factors that play into that.
Got you. So beyond Delaware County, I learned that Black women are at higher rates of admission into the ICU during delivery than white women. Is this similar to what you found in Delco?
Yes, and I think that, again, one of the major reasons is women are going into pregnancy sicker, and they're not getting care as soon as, many women don't get care in Delaware County until after their first trimester, which is, the longer that you delay care, the women have worse outcomes. And so we really need to ensure that women have access to care, and that they have, and know the things to make them healthier. And then also, again, I can't say it enough, but the social determinants of health. Why are women sicker in their communities?
Mm-hmm. So last summer, I also learned that one of Delco's birthing hospitals was closed, the Delaware County Memorial Hospital, and this hospital was known to serve a large population, including many who did not have English as their first language or were low income. So now Crozer Chester has also closed too. So in spite of these valiant efforts of many to keep it. So can you comment on that for us?
Yeah, I mean, it's for public health and health care in Delaware County, it's really a blow to lose the Crozer health system. And particularly for maternal child health, it's been one of our major concerns. We've had committees working on this ever since Delaware County Memorial closed. So the health department, we formed the Maternal Child Health Committee. And so we brought all kinds of stakeholders together to work on things. One of the things that came out of it, we were able to write a grant, and we got money through the health department to improve doula services and increase them, which we think is a critical need, especially in immigrant communities, lower income communities, because doulas, if you don't know much about them, but they really help women at critical points in their pregnancy to understand what pregnancy is, but it's somebody from their community. It's, they're trusted, they feel comfortable with them, and they will follow them through they'll actually be there at the delivery and then the postpartum phase. And doulas have proven to have much better outcomes when a woman has a doula. So it's just like another cheerleader in your corner kind of thing. So that doula program I think is really exciting. But the actual the other thing that we're trying to do is possibly looking into having a birthing center in Delaware County, which we think would be really positive, especially in Upper Darby and Chester. But that's going to take time and money. Yes. And that's, so we're working on that. there's a lot to this whole thing with Crozier. And so one of the things we're hoping is that the federally qualified health center, ChestPen, might be able to increase their OB and gynecological care, because that's an issue. And then right now, the only delivery hospital is Riddle. So working with Riddle and trying to increase their capacity. And then, working with the insurance companies too, the Medicaid plans, and making sure that they can provide, in things like transportation when it's needed for the mom, and increase their contacts with their clients to make sure that they have everything they need for a healthy delivery.
Well, given the recent passage of that big, beautiful bill that has some concerns regarding its Medicaid cuts, what do you think might happen further in this regard with hospital closings?
Yeah, so
it's care.
It's predicted that there will be hundreds of hospitals closing. Medicaid is central to many hospitals' operation, including in Delaware County. So there's a large concern. I mean, they focused on rural communities, but right here in Delaware County, we're almost becoming a desert of care. So even though we're surrounded by Philadelphia and Chester and Bucks County and Montgomery County, there's just access to care is going to be really impacted. And I think many hospitals, even in those communities, will be impacted by this. That's the big, beautiful bill really focuses on the Medicaid part. From our perspective, there's lots of other things in there, but the decrease in the tax revenue is also a concern, because for appropriations, which is the next step, the next real budget for the government is coming up. And for things like Title V and other areas in maternal and child health, there could be substantial decreases in that, just because there's less money now, because we gave huge tax breaks, and then also we have a huge deficit. So many of us are concerned about what that future brings to maternal child health.
So from my research, I learned that maternal deaths may result from the discrimination and disregard that Black women are likely to face in medical care. Did you find this to be the case when you worked as part of the Maternity Care Coalition? Yes,
unfortunately, it's something that's very prevalent. And many health systems are really working hard to re-educate their healthcare providers. But some of it is, again, even subconscious for many people. There's not, and that's really hard to break down in a community. So, we had many reports of women who would go to see the doctor, and they would discount, that they've had a pain or that they're not feeling well. Even one of the critical phases, and there's maternal mortality review committees review this, and one of the critical things is many women die. We consider that first year as the area that they can be at risk, and many women die within a few months of giving birth, because they're one, they don't know that the things that they're experiencing are not normal. And then second is that sadly, many healthcare professionals have discounted, I have a terrible headache, and that's a sign of preeclampsia and high blood pressure, which is a high risk. And so, really making sure women have the resources they need. And that's why we say the doulas, connection to home visiting programs, connections to special programs that many of the hospitals are running now that follow women longer, are really critical to making sure that that doesn't continue.
I know you've mentioned a little bit about what the Department of Health in Delaware County may be doing for Chester, but I was concerned when I went to a recent meeting and they said there's not even one doctor that's practicing in Chester at the moment. Is that something that you're considering doing something about?
Well, so, the health department we're really there as kind of like the strategic planner. And so we have limited services around that we actually provide, which is like vaccines and sexually transmitted diseases and TB. But we are working closely and hope there is, again, ChestPen, which is in the city of Chester. And then there is an emergency AFC, which is another emergency clinic there. So, but there's not enough for the city of Chester. Our concerns really are around emergency services, truthfully, transport. So when Crozier closed, we lost 50% of our ambulance service and EMT in Delaware County. And critical would be in Upper Darby and the city of Chester. And so the way the law works in Pennsylvania is that each municipality is in charge of their EMT services. That's not something the county provides. And so these municipalities, and that's over half the county, have to come up with the money to have EMT services, which can be very expensive. And we estimate in the city of Chester that would be $1.3 million. And so there's that challenge, and that's as concerning to me, actually, because it's one, to lose the hospitals and to lose the care providers, but we're also looking at the loss of emergency services. So there's a system in place now, and we've brought things together, and again, been this strategic planning with a lot of great people in the county have been working on that. And so, I think we'll have some, safe coverage for now, but it's not, we need a longer term solution. And then the other piece to this whole thing is really looking at longer term, what are the needs for the city of Chester? We're hoping other health systems like Christiana, which has bought all of the outpatient facilities, that Christiana and other healthcare providers may open up in this, wilderness of care. So, there's a lot there, and we could talk about just that here today. But it does put women at risk if they're not going to get regular care before they're pregnant. As I said, many women go into pregnancy unhealthy, and then add on top the lack of access to care is going to be a problem.
So many Black and brown women are deprived of equal chances to have a safe delivery because of social determinants, like you said, economic, emotional, physical well-being. But Chester is an environmental justice zone with hazards such as poor air quality and other pollutants. So what barriers do you feel are the most persistent in improving maternal health outcomes in Delaware County?
Yeah, we've been working a lot with the city of Chester, and there's, again, great groups there. Christine Motley, has been doing a lot, and we've worked really closely. And she's another pharmacist like me. And so, but what I think what we're currently focusing on, which people might not get this, is lead poisoning. So lead poisoning in communities throughout Delaware County, we have really old homes in Delaware County. But what people don't understand is lead poisoning is a really high risk for pregnant women. And so if a pregnant woman, it makes her, they could have preeclampsia. The lead could transfer through to the baby during pregnancy, depending on the level that the mother has. It also, which means it could cause long-term complications for the baby. It can affect the baby's growth and development. So there's also, so we're actually trying to increase awareness and testing in the city of Chester and throughout Delaware County, and the health department just launched a huge ad campaign and education campaign throughout the county just to raise awareness of these issues. And so we're really trying to communicate more with the communities directly and making sure people understand the environmental toxins that are around there. That's just one. It's certainly the city of Chester has been, as you said, an environmental justice area. So there's, also an incinerator there. There's also issues of, there used to be something called the Wade Dump, which is now where the soccer stadium is. So there's a long history, and there's a compound issues when environmental justice in area communities last a long time, and that's passed down through generation to generation. So there's a lot of work that has to happen, not just in the city of Chester, but all along the I-95 corridor, particularly in this area. And then just looking, there was recent studies that said because of lead poisoning in gasoline and other things, particularly prior to 1978 when that was banned, they now link that to high mental health issues, and it's estimated 168 million people may have been impacted by that.
Wow.
So there's a lot going on around these environmental justice issues, which we should be really delving into, and that's a very big public health focus right now, along with many, many other things that we have to think about.
So you obviously do a lot of policy work at the county and state level, and this includes some budget items and specific momnibus legislation. And you also work with the Pennsylvania Perinatal Quality Collaborative. So can you speak to the policy implications of your work?
Yeah, so my work right now actually is more the work I did before and with Maternity Care Coalition, but I'm very close to the people working on that. And then other, our organizations are supporting the work of those types of organizations. The Momnibus in Pennsylvania had some victories, which is great. One of the biggest things, and I kind of worked on this when I was at Maternity Care Coalition, I was at the very, very beginning of this thought process, was increasing Medicaid for 12 months postpartum. So usually what happens if the mom can be temporarily put on Medicaid if she has no other insurance during pregnancy. And then when she is at the end of her pregnancy and delivers, 6 weeks later, she's done. And as I said, that first year postpartum is very critical. So extending the mom's coverage for 1 year postpartum ensures that mom and baby are getting all the health care services that they need. And that also includes a mental health screening, which was another win that we had with them. And so monitoring mom for her physical and mental health is critical. And that is one of the major factors in mortality, morbidity for women.
So as you've said, there have been a lot of wins from 2024 legislation. Are you able to speak to the PA Department of Health's new division of maternal care?
Yeah, so that lies in the Division of Family and Community Health at the Pennsylvania Department of Health. So that's a bureau, and then there's the divisions. And so that's very confusing to people. But as it was part of the legislation, and the governor was passed that they were allocating $4 million. And that's going to be really exciting. Maternity Care Coalition has been appointed as one of the, there's going to be 4 hubs for this. And it's to bring the community together to do assessments, looking at data, doing community communication, and also looking at social determinants of health again, and all those factors. And also for the first time, we'll bring in the Maternal Mortality Review Committee's recommendations and try to implement through these 4 regional centers for maternal health. So I think it's a great improvement. We'll see. It's just starting, so it's hard to know what the long-term implications are, but I think it's a positive step.
So we've talked a lot about the Momnibus legislation. Are there any other important parts about that legislation you think we should know? So
there's 2 Momnibus actually. So there's the federal one, and then there's one in the state. 23 states have passed full Momnibus legislation, so that's really a positive step. The complete Momnibus includes things like breastfeeding and doula care. So the doula care actually just recently passed as well, and that means that Medicaid will be including doula services, which was critical to us doing the maternal child health committee and implementing the doula services in Delaware County. So that allows the doulas to be paid, which is critical to have women perform a service and get paid for. And so that'll allow us to expand the doula services. So I think that's kind of a missing piece to all of this. If you look at the models in Europe and things, they have a lot of midwives and, really nurturing types of situations for women who are pregnant. And so we have a long way to go to accomplish that. But that's my hope for the Momnibus, that it continues to do this.
So I've also heard about initiatives for lactation cafes. Can you share what you know about that?
Yeah, so the lactation cafes are kind of a growth of a lot of the movement for breastfeeding. And they're really just an opportunity for women to who are breastfeeding to breastfeed openly and not worry about people making comments that you're feeding your child. But also it helps women who might be pregnant or thinking, have questions about breastfeeding to have a place to go and share and see what this is all about and learn from each other. I know, as I'm a mom of 3 kids, when I wanted to breastfeed. My mom didn't breastfeed us, so she wasn't a good resource for me. And I relied heavily on my friends to learn about it. And I think that's a great environment for women. And now it can be open, and it's not like something that has to be hidden. And it's a natural thing, and we should be promoting it. One of the amazing things, one of the legislations I worked with was allowing women to be able to breastfeed and have time to breastfeed or pump at work. And, when I told people, my family in Ireland, and they were like, what do you mean that that you have to pass a law to allow a woman to pump while she's at work and she's trying to feed her baby? Like, that's just a natural thing you should be doing. And so there's crazy things like that, that we continually have to fight for the rights of women to be able to have a healthy pregnancy and then take care of their child through breastfeeding.
So as I mentioned before, I met with Representative Borowski and Representative Gina Curry, and I found these legislators to be very supportive of public health and trying to fix maternal health disparities. So has your work helped shape the creation of their political positions, and if so, in what way?
Yeah, that's what health policy is all about, right? It's educating. It's advocating and educating and making sure that our elected officials know what's happening in the community, and then what is some solutions, because it's easy to tell them to do something, but having concrete solutions for them to take action on is critical. So I think that, the advocacy done by organizations like Maternity Care Coalition, and also Children First and other organizations like the League really helps to, firm up and give support behind the legislators that want to do these initiatives. Because, if you want to get something passed, it's a long process. And so having organizations that will keep, the energy going and support you in doing that really, makes it more likely for success.
So what policy change are you most proud of in your advocacy for maternal health? There's
a lot. Currently, we're trying to get a bill right now passed that it's 2 tests by 2 for children, but it also includes pregnant women being tested for lead poisoning. And so I think that's one that we're hopefully, can get past the session. But going backwards, I think for me, there was one of the ones that I was got involved in, and it's sad that we even have to talk about it, but there was a bill. We had to have a bill in Pennsylvania because women who were incarcerated, who were pregnant, had to be shackled during their prenatal appointments and during delivery. And that, unfortunately, it makes sense for us. No woman is going to run out while delivering a baby. And most of those women who are incarcerated are often actually just incarcerated because they couldn't get bail. They couldn't afford the bail. And so many of the women, we were able to change that law. It took several years. But whenever you pass a bill, it's ensuring that it's enforced. And so even though we passed that bill, we still are making sure that we have to provide training to the staff at the facilities, the prison and jails, and then also making sure that hospitals are also aware of this, because many of them, just revert back to whatever the
practice.
With the
past practice.
Yeah. So, I think that when I think of something that really impacted, can you imagine a woman who's giving birth, who loves her baby, and, you're having her shackled, and it's your arm and your leg that are shackled, and, she can't even hold the baby. It's just the bonding that needs to happen, just feeling like that she's, for that time period, a free person to deliver. That was the one that's always stood out to me.
Since I'm interested in pursuing a career as a nurse, I'd like to take this opportunity to ask you some questions to help guide future career choices. So what inspired you to transition from pharmacy to public health policy and then to maternal health specifically?
So when I was doing my work as a pharmacist, I was constantly being asked to do things like safe medication workshops, going. I would work with the American Academy of Pediatrics, the PA chapter, presenting to moms and children, and just helping them understand how to give medicine. So I constantly was being drawn into it, and then as I learned more, I was involved with the Pharmacy Association, and they asked me, we were trying to do flu vaccines in Delaware County, this is like 20 years ago, and they said, oh, talk to the health department in Delaware County. Well, I'm like, there is no health department, and that really, the more I delved into that, I realized that there was a great need. But public health is, I was just attracted to that because it was able to do the whole community versus healthcare is an individual, but public health impacts the entire community's health.
Thank you. I really appreciate Kate and Rosemarie for coming today. We've certainly learned a lot from both of you, and I want to let our audience know that we would not be able to do programs like this without the support of Mainline Television Network. And their support makes it possible for our communities to become educated and learn more about public health and other issues in our community. And our audience, of course, we are most appreciative that they have tuned in so that they can stay informed and also become more involved in our public participation. Because as you know, democracy depends on civic participation. And we hope that those of you who are watching might consider joining the League of Women Voters. We're open to both men and women, and to students like Kate, we provide free membership. And we hope you'll continue to stay informed and watch what's going on in Delaware County as well as Radnor Township. Thank you again.